Hi, everyone. Welcome to Change Class 7. This is titled Nutritional Guidelines After Bariatric Surgery. Today, we are going to discuss common nutrition-related problems that we see after surgery, as well as introduce the diet progression that you all will be following after you have your bariatric surgery. Just to test your knowledge here before we jump into the material. With the Roux-en-Y gastric bypass surgery, your stomach is reduced to the size of a what? The size of a pea, the size of a cup, the size of a walnut, or the size of a fist? The answer is C, walnut. Now, I know not all of you are moving forward with the Roux-en-Y gastric bypass surgery. Some of you may be considering the gastric sleeve. In that instance, the stomach is going to be a little bit larger. It's going to be about the size of a small banana. The reason I like to provide this information right off the bat here is because all of these different nutrition problems that we see will likely be easily understood by knowing the size of the stomach that you're working with after surgery. So let's talk through all of those different nutrition related problems. The common problems that we see after surgery include dehydration, nausea and vomiting, dumping syndrome, lactose intolerance, and constipation. So we're going to spend some time going through each of these in detail. Dehydration. So dehydration is caused by rapid weight loss, having a low fluid intake, and fluid loss. And that could be related to vomiting and diarrhea. Some maybe food intolerances can cause these problems, the vomiting and diarrhea. And we'll be talking about how to help minimize those symptoms. Problems associated with dehydration include low blood pressure, constipation, and kidney stones. To identify if you are experiencing dehydration, you can look for these symptoms or multiple of these symptoms. Concentrated urine, so taking a look at the color of your urine, seeing if it's a deep concentrated yellow or if it's a light pale yellow. The darker, the more likely, you're dehydrated. Constipation, dizziness, dry mouth, fever, nausea, and thirst. Your daily fluid recommendation after surgery is to get in at least 64 ounces of total fluids in the day. So you can include a combination of these fluids shown here. Of course, water counts, bouillon and broth, sugar-free, non-carbonated beverages. So you can do things such as, Gatorade Zero, Powerade Zero, Propel, things like that. Decaf coffee and decaf tea. Sugar-free Jello, sugar-free or no sugar added popsicles, skim milk or 1% milk, low-fat cream soups, and tomato or other vegetable juices. Now, the clearer liquids, the water, bouillon, tea, so forth, those are going to be more hydrating than the full liquids like the milk, the cream soups, the tomato juice. But in general, we just encourage you to try to get at least 64 ounces of total fluids. What does make it challenging to get in enough fluids to stay hydrated is the fact that you have to separate your liquids from your meals. We want to make sure you're not drinking and eating at the same time. You have a very small amount of room in your stomach, so drinking liquids while you're eating will fill you up really quick and likely inhibit you from getting in enough nutrition at each meal time. Also, drinking liquids at the same time as eating can actually cause dumping syndrome, which we're going to talk about in a little bit. So, what we encourage you to do is to stop drinking liquids 30 minutes before you're going to eat a meal. Don't drink while you're eating, and then wait 30 minutes after a meal before you start to drink again. So, it's a lot of time that you have to avoid drinking liquids. And we have a sample morning routine on the right-hand side. So let's say you wake up at 6 a.m. That first half hour that you're awake, and we encourage you to drink some water. Between 6:30 and 7, don't drink anything. And then at 7 a.m., you can eat your breakfast. After you finish your breakfast, avoid drinking for 30 minutes and then you resume. And that's the routine that we want you following all day long, regardless of what meal it is. If you're not in this habit right now, I do encourage you to really practice this. And maybe you try to set alarms on your phone to remind yourself to stop drinking. Like let's say you're going to eat lunch at noon, set an alarm at 11:30 for every day to kind of trigger your brain to putting that water bottle away, out of sight, out of mind, so you don't get tempted to drink before you're going to eat. And right now, your stomach can handle liquids and solids at the same time, but after surgery, it won't. Going on to the next nutrition problem we see, we have nausea and vomiting. The causes of this can be from eating too fast. So we want you spending 20 to 30 minutes eating your meals, not chewing your food well enough, eating after your pouch is full, which kind of goes along with eating too fast, and drinking liquids with meals. So the guidelines, as mentioned, spend 20 to 30 minutes eating your meals and drinking your liquids slowly. So instead of chugging or gulping a lot of liquids at once, try to sip your liquids throughout the day. Have your water bottle or beverage with you all day long so you can stay hydrated and not feel the need to drink a lot at a time. Chew foods well. So we want you taking about 30 chews per bite of food. Really get that food broken up before you swallow. And a strategy that can help with this is using smaller forks or spoons, which can help you just take smaller bites and not feel that you have to chew um, so much because the bite's already smaller, so there's less to chew up. That can help too. Stop eating when full. Really practice um, getting in tune with those fullness cues, especially when you're tracking your food on those paper logs. Drink liquids between meals, not with meals. Dumping syndrome. Dumping syndrome is a rapid entry of food and liquid into the small intestine. So, dumping syndrome essentially will happen within 5 to 10 minutes of eating or drinking something that would cause it. And you'll notice symptoms such as nausea, abdominal cramping, weakness, sweating, dizziness, rapid heartbeat, potentially diarrhea. Some people experience multiple symptoms. Some may only experience one. So it does vary from person to person, but it is manageable. It is preventable. The causes of dumping syndrome include eating too quickly. As you see, that's kind of a trend amongst all of these problems. Consuming beverages and foods with added sugars. So just, straight sugar, could be honey, could be candies, it could be baked goods, it could be like sweet beverages, think specialty coffee drinks, soda. It could be a variety of different sugary foods and beverages. Eating foods with excess added fat. So high fat meats, could be fried foods, could be full fat dairy, ice cream, things like that. Drinking liquids with meals can cause dumping syndrome, as mentioned previously, and eating foods with large amounts of sugar alcohols. Some people are sensitive to sugar alcohols after surgery. So if you are one of those, you may want to continue to look at those nutrition labels under the ingredients list and see if you're getting any of those sugar alcohols in the products you're choosing. Again, any of those ingredients ending in ITOL would be a sugar alcohol. So that's what could make it a little confusing after surgery because a lot of those like diet products or low sugar products may have sugar alcohols. So you think, okay, well, I'm not eating added sugar. Why am I experiencing dumping syndrome? That's where you would take that next step and see, okay, am I getting any sugar alcohols in my foods? Because that could potentially be a cause. But again, not a cause for everyone. Another problem we see is lactose intolerance. So, lactose intolerance is the inability to digest the sugar that's found in dairy products. That sugar is called lactose, and this is caused by a lactase enzyme deficiency. Lactase is the enzyme that breaks down lactose in your body. So, those of you that have lactose intolerance now likely will still have it after surgery. But there is a chance that someone that doesn't have lactose now can still develop it after surgery. In gastric bypass, part of the intestine that is bypassed creates, helps create that lactase. So while it's still being produced in your body, after surgery, it may be harder for your body to keep up with producing enough lactase to break down the lactose you're consuming. So, if you do experience lactose intolerance after surgery, it would be after consuming products that have lactose, so dairy primarily, think milk and other milk products. You would experience maybe some bloating after consuming dairy. You would experience maybe some flatulence, maybe diarrhea, more lower GI symptoms. What can you do if you experience lactose intolerance? Some of the guidelines include consuming smaller portions of milk at a time. So only drinking maybe a half of a cup of milk at a time and drinking it slowly. So again, your body has enough time to produce adequate lactase. You can try taking lactase enzymes with meals that contain lactose. So you can buy over-the-counter enzymes. You can also purchase lactose-free milk, which is my typical recommendation. There's different milks out there that are taste just the same as regular cow's milk. They just are lactose free. I also like this recommendation of choosing a lactose-free milk because milk is a great source of protein after surgery. And so if you're willing to drink it, I would encourage it. The last problem we'll talk about today is constipation. Constipation is caused by a lack of fluid. As we mentioned, it's hard to get in adequate fluids after surgery, a lack of fiber. As you're going to learn shortly, the diet right after surgery is going to be fairly low in fiber and lack of activity. A change of routine can cause constipation and also medications. Think after surgery, you might be taking a little bit of pain medication, and that doesn't help with the cause. What can you do? You can try to drink 8 cups of fluid or more a day, getting in that 64 ounces a day. Increase fiber slowly. So as you progress through the diet after surgery, you naturally will be increasing fiber. Increase activity. We do encourage you to get moving as soon as you feel ready to start walking after surgery. That will help with just GI transit, regularity. Establish a routine with your meals, a routine with walking, and you can contact a healthcare provider, someone on your bariatric team, if you are still struggling with this despite some of these guidelines. What to eat after surgery. So now we're going to talk all about the diet progression. You will all receive a book from your dietitian and education from your dietitian on this diet progression, but we are going to go through the basic information today. So there are 4 diet stages after surgery that you are going to follow. Prior to full liquids, you will be on clear liquids in the hospital. Once you get discharged, you will start on full liquids right away, unless told differently from your surgeon. Full liquids. So, being stage 1, you're going to start on this stage, as mentioned, as soon as you get discharged, and you will be on the stage for up to 2 weeks. We want you drinking at least 8 cups or 64 ounces of liquid per day. And when you're drinking your liquids, make sure you are sipping slowly. So sipping 8 ounces over the course of an hour. And try not to drink more than a cup in an hour. We want you to drink 2 low sugar protein shakes daily. Want you to avoid carbonated beverages and alcohol while you're on this stage and through the whole diet progression, not just this stage. And you can include other foods and drinks with a thin, runny consistency. So full liquids must be able to pour easily through a strainer. You can consume yogurt with liquid added, and I'll show you on the next slide what I mean by that. You can consume blended soups. You can consume low-fat milk or other milk alternatives. And on the right here, you can see what a sample of a single day can look like. So we have 2 protein shakes. There's a variety of different ones you can choose from. You can do some cream of wheat that's nice and thin, Greek yogurt that's thinned out, blended soup that's thinned out, and a cup of milk. You don't have to include all of this in your day. That may be difficult, especially really early on post-op, but those are just some suggestions. And when we're talking about yogurt and chicken noodle soup, you see here, these are blended very well. There's adequate liquid added to these when you're blending, so that way we can get them to a consistency that is pourable. See, it's not chunky, no pieces. It is fully blended and strained. That's the consistency we're looking for. Stage 2 is blended pureed foods. So you are going to be on this stage for 2 full weeks. While you're on this stage, everything needs to be a smooth consistency with no solid pieces. I encourage you on this stage to aim for 3 meals a day. And with those meals, you can aim for about a quarter to a third of a cup of food at a time, which would also be equivalent to about 2 to 3 medicine cups. In addition to those 3 meals a day, I would like you to try to get 2 to 3 high protein, low sugar drinks in your day. If you were to just eat 3 very small blended meals a day, you're likely not going to be able to hit your protein goals, which you see on the slide. Your protein goals are 60 to 80 grams a day. In addition, we want you to get in 64 ounces of liquids a day. And you can count your protein shakes towards that liquid goal. You can count all of your beverages towards that 64 ounces of liquids. As far as recommended foods on this stage, first I like to focus on the protein-rich foods. So you can consume blended meat like blended beef, chicken, turkey, pork, tuna. And as a meat alternative, you can do blended tofu as well. Often I see patients actually doing soups when they're talking about, eating blended meat. They're usually not just blending the meat by itself, but with soups. More high protein foods include Greek yogurt, mashed cottage cheese, ricotta cheese, milk, blended refried beans that are fat-free, and blended scrambled eggs. You can also include low protein foods, applesauce, mashed banana, cream of wheat, blended oatmeal, mashed potato, and blended low-fat cream soups. Now here are some pictures on what that consistency looks like, what the blended pureed consistency is. So this first set of pictures on top is like a tuna salad that is liquid added to it and blended. So there's no chunks or pieces. I would consider this like a spoonable consistency rather than pourable. And then the bottom 2 pictures again is your chicken noodle soup, but now it's in the blended pureed form. So it's going to be thicker than that previous picture you saw, but still no chunks or pieces in it. A good idea during this stage is to add more protein into your meals. So some of those foods that are low protein, you can add in protein powder. You can add protein powder into oatmeal, cream of wheat, even applesauce. You can add unflavored protein powder into soups, mashed potatoes, and sauces. There are different milks out there that are higher in protein that you can use when preparing foods. One of the common brands out there right now is called Fairlife milk. So instead of 8 grams of protein per cup, Fairlife gives you like 13. So you get more bang for your buck, and you can use that milk or a milk similar to it to make sugar-free pudding just to bump up the protein. You can make oatmeal with that milk. You can make cream of wheat with that milk. Some folks like to freeze their protein shakes into popsicle molds. So you can buy silicone molds or something like that and just pour a ready to drink shake in there, and you're helping reach your protein goals while having a nice, cool treat. And you can also use your protein shake as creamer for your coffee. Those first few weeks after surgery, we don't want you consuming caffeine, but you can still drink decaf coffee during that time. After those 3 or so weeks, you could resume to drinking caffeine in moderation. Here's a sample meal plan for a blended puree diet. So you start off your morning with a quarter cup of Greek yogurt. As a mid-morning snack, you can have half of a protein shake. I do typically encourage only a half of a shake at a time, especially this early on, because we want you to really take your time drinking, not chugging your liquids, just kind of sipping. And so a half at a time is appropriate. Then lunch, you can have some soup with protein powder added. As a mid-afternoon snack, you can have some milk that gives you some protein. Dinner, we have a ricotta bake. This is a common bariatric recipe out there, which is 12 grams of protein. And then as a evening snack, you can have a high protein yogurt smoothie. So that brings you to a total of 70 grams of protein for the day. And again, our goal is between 60 and 80. Stage 3 is soft foods. You are going to be on this stage for 4 to 6 weeks. On this stage, everything needs to be tender and easy to chew. We still want you aiming for 3 meals per day, but the volume is going to change slightly. Now we're going to bump it up to a half to 3/4 of a cup of food at each meal. We want you getting in 60 to 80 grams of protein a day and 64 ounces of liquids every day. You likely will still need to drink a protein shake in your day to hit those protein numbers. The 3 meals a day the portions are still very small. You probably won't be able to get in enough protein in those 3 meals. So still plan on drinking at least one shake every day. For recommended foods, I will start with the protein. So you can do ground beef, ground turkey, shredded chicken, flaked fish. You can do eggs in any form. Beans you can eat whole, they don't need to be blended anymore. Lentils, Greek yogurt, cottage cheese, and milk. You can eat soft cooked vegetables. I just recommend steaming or boiling them. And you can eat fruits without the skin or large seeds. Now, foods to avoid. Definitely avoid those tough meats. Avoid raw vegetables, even salads, but also any of those crunchy like baby carrots, celery, cucumber. Avoid all of those on this stage. And avoid fruits with skin, large seeds, or membranes. So definitely avoid things like the citrus, like you see in the picture. I would encourage you to avoid like apple skins, avoid pear skins, um, and then any large seeds found in fruits. Here's a sample meal plan for the soft food stage. It does say blended pureed diet on there. I do apologize. This is for the soft stage. So you can have a Greek yogurt with some sliced banana for breakfast. You can mid-morning have some coffee with half of a protein shake added, or you can just drink the half a shake by itself. For lunch, you can do a meat and cheese roll up. For a snack, you can do half of a protein shake. And then dinner, some shredded chicken, some sugar-free barbecue sauce, and some steamed baby carrots. And last but not least, we have stage 4, which is regular foods. So you're back to being able to eat normal texture foods, no specific restrictions here. We want you eating 3 meals a day. And again, one more time, you're going to increase that volume. And you're going to end up at about a cup to a cup and a half of food at each meal. Want to make sure you're chewing those foods thoroughly, consuming 60 to 80 grams of protein daily, and getting in 64 ounces of fluids daily. And this is just a picture, a good example of what your plate should look like after surgery. So it's going to be a small plate. Think salad size plate or even a little smaller. Protein is going to take up about a half of that plate. Vegetable is going to take up a little bit more than a quarter, and starch is going to be taking up a little bit less than a quarter. And I do encourage you from here on out to try to eat your protein first, followed by your vegetable, and then your starch, if there's room. The reason behind that is because we want to make sure when you fill up, you're not filling up on the starch or vegetable first. You're getting in that protein that your body needs. And then you move on to the other food groups. Some golden rules I like to encourage you to follow after surgery. As just mentioned, protein first, then eat your vegetables, then your fruit and grains. Sip liquids slowly between meals, not with meals. Drink at least 64 ounces of fluid every day. Eat the recommended number of meals daily. Chew foods thoroughly. Stop eating when you start to feel full. Take supplements as recommended and be active every day. In terms of follow-up with your dietitian, you're going to meet at least 4 times that first year after surgery. You're going to meet your dietitian at 3 to 4 weeks after surgery, 3 months after surgery, 6 months after surgery, and then 1 year after. After that first year, we do recommend annual follow-ups with your team. So your dietitian, your endocrinology team that you've worked with before surgery to help with your long-term success. And that concludes class number 7. There was a lot of information today pertaining to after surgery. If you have any questions, please don't hesitate to reach out to your bariatric team. We'd be happy to assist you. Have a great rest of your day.